So before we jump into the practice questions, I wanted to show y'all one really helpful resource that we're going to use throughout the webinar. So this is our NCLEX Bootcamp Prioritization Pyramid that we worked really hard on to try to give you guys a resource or a tool so that when you are sitting there trying to figure out a prioritization item, you can look at this pyramid and it kind of helps you have a strategic approach to help guide you as you navigate these questions. So we've all heard probably people say, oh, prioritization, just focus on ABCs, that kind of thing. And although that information is helpful, that really doesn't look at the overall picture and it's not very comprehensive. So that's where this prioritization pyramid came in. So let's briefly talk about how do we use it, and then we will practice with it on a couple of questions. So the first thing we're going to do whenever we see a prioritization item is we're going to start with step 1 over here on the left, and we're going to eliminate any stable or chronic issues. So let me give you an example of that. A stable issue would be a client that, for example, has a fracture. Maybe they have a fractured wrist and they have some mild pain and swelling at that site. Is that stable? Do we think that that's expected and normal for this client? Yeah, there's nothing to indicate that that client's not stable. Now, if it said that you have a client with a wrist fracture that has no pulses distal to the injury, or they have decreased sensation or tingling, that would all be concerning findings that our client might be unstable and experiencing a perfusion issue. But in this case, the client's stable. So they would not typically be a high priority, and we can eliminate them as a high priority before we look at anything else. Another thing that we can typically eliminate right at the beginning is chronic issues. And an example of a chronic issue would be, for example, a client with advanced COPD. Can someone tell me, what do we expect the normal pulse oximetry range to be for a client with advanced COPD? Do we expect it to be normal, above 94%, like it is in most clients? Probably not. So it's typically going to be about 88 to 92%. So if we're looking at a prioritization item and it says that we have a client with COPD with a pulse oximetry of 90%, we can expect that. It's a chronic issue and that's normal probably for that client. So once again, these guys are typically not our highest priority. So we can eliminate them, and then we move on to step 2, which is actually looking at that pyramid. So the bottom in bright red to get your attention are the issues that require immediate intervention typically. And those are going to be airway and safety issues. So any type of acute airway or safety issue is usually our highest priority that needs immediate intervention. And then it is followed by breathing, circulation, and disability. Disability is just another way to say neurological, so altered mental status, stroke, that type of thing. So we can do our A, B, C, Ds, and once again, safety and airway are both very high priorities. And then our lowest priorities are at the top of the pyramid. And that's gonna be our routine tasks, our expected findings, and then psychosocial needs. And what I mean by psychosocial needs is just anxiety or frustration. Although those things are, not ideal, they typically are not going to kill us. And that really, guys, is the fundamental principle to follow when we're looking at prioritization, is we have to ask ourselves, if we don't perform this task, or if we don't see this client, who's going to die first? Like, what life-threatening condition do we see? Because that's always going to be our highest priority.